So question number 9, a 25-year-old professional wrestler recently participated in a charitable tournament in Bora Bora. During his stay, he wore tight-fitting clothes and tight bathing trunks for extended periods. After 6 days, he developed a symmetric erythematous itchy rash in his groin with a significant amount of moisture and scales. Central areas of the rash were hyperpigmented and border is slightly elevated and sharply demarcated. His penis and scrotum are not affected. He immediately visited a local dermatology clinic where a specialist conducted a wood lamp examination to exclude the presence of a bacterial infection by Corynebacterium. He is healthy and on no medications, and a CBC profile is normal. The working diagnosis is a fungal infection. Which of the following topical agents should be preferred, assuming there are no financial barriers? Very good. This is Tinea curis. All right. So usually whenever they'll be talking about Tinea curis, that is a skin infection. Okay, superficial dermatophytic infection. So they will be giving you a history of wrestlers or someone in crowded place, and after that they develop or wearing tight fitting clothes like sports person or something. They'll be giving you this history very well. Okay, and then after that they suddenly develop a symmetric erythematous itchy rash in the groin. All right. So basically, and then look at the rash description. It is very peculiar for your tinea. So there are central areas of rash, hyperpigmented, and the border is slightly elevated and sharply demarcated. I don't think there is an image over here. Yes, so this is your tinea. This is slightly elevated as mentioned over here. I'll open the question also. Hyperpigmented central area with an elevated border and sharply demarcated. Okay, as shown over here. Okay, this is not the part. This is they are talking about a groin rash over here. All right. And now the specific test is wood lamp examination. Why they did a wood lamp examination was to exclude a bacterial infection by Corynebacterium minutissimum. All right. So don't worry about the name. Just remember Corynebacterium. They try to rule out a bacterial infection called erythrasma. I'll show you the image, and it will be very easy to remember because dermat is more about images. Okay. So can you see how different is this from the previous one? This is erythrasma. This is not an elevated scar or something. Okay. Unlike your tinea, this is well within the skin, and this is a big scar which is not very well demarcated. Unlike your tinea, which was a slightly elevated and raised kind of central clearing. Okay. So tinea, drug of choice is terbinafine. Anyone wants to tell me the mechanism of terbinafine? Quickly, you can mention over there in the chat. Yes, very good. Squalene pathway. You're very close to it. All right. So I'll show it over here. So this is your basically squalene is a chemical present inside your inside the fungus. Terbinafine prevents squalene, acts on squalene epoxidase. Okay, squalene epoxidase is an enzyme which converts it into squalene, which forms lanosterol, ergosterol, and eventually a cell membrane. It's not the cell wall; it's the cell membrane. Okay. Yes. So basically, these terbinafine will bind to your squalene epoxidase. It will prevent the formation of your cell membrane, fungal cell membrane. All right. And see, like we had talked, amphotericin binds to ergosterol, and it makes pores in the cell membrane and then damages the cell membrane. Okay. And then we have your fluconazole, ketoconazole act over here, which eventually prevents cell membrane formation. Am I clear? So there is one more disease which might confuse people. So we talked about 3 diseases. One is tinea, one is your erythrasma, and one is your candida. Okay. So you will notice here, as I'll show you in the question, when there is a candida infection, when it is present in the groin, okay, it will involve your scrotum, and also it will have big satellite lesions. Satellite lesions are basically there is one large lesion and surrounded by small dark red lesions around the rash. Okay. Then erythrasma was something which I showed you over here. This is a bacterial infection. Okay. which is not very well demarcated, widespread, reddish in color. Then you have your tinea. This is slightly raised and reddish in color and has a central clearing. Am I clear to everyone? Yes. And as they mentioned over here, they did a wood lamp examination. Wood lamp examination will differentiate between your tinea and erythrasma. And to differentiate your candida, see, it is mentioned over here, he develops a significant rash, but the penis and scrotum are not affected. It's very well mentioned. So that means candida is more or less ruled out. Okay, the description of candida rash, like I told you, will be there's a big rash surrounded by satellite lesions.
Thanks for watching. Please give a thumbs up and subscribe for more.